This procedure is what we call oral prophylaxis or dental cleaning in layman's term. These hard deposits are what we call calculus or calcular deposits or tartar. A lot of bacteria and microorganisms form this over time, especially if we will not get our cleaning done every 6 months or regularly. Plaque hardens and becomes calculus, especially if we are not brushing our teeth properly and we are not using dental floss. This is also one of the main reasons why we are having bad breath, gum inflammation, and gum bleeding. Once the calcular deposits are removed, you can see that there is an inflammation or red part under it. This means that these deposits push away your gums from your teeth and it caused swelling. This calculus easily irritates our gums, and once our gums moved away from our teeth, there is a high chance that the roots of our teeth will be exposed. Once it is exposed, you will feel a lot of sensitivity or pangingilo. The most common site where calcular deposits are accumulated is the back of our lower teeth. So don't forget to brush this part along with all the surfaces of your teeth. Like any other wound, fibers are starting to form to heal the area. So again, don't forget to always brush your teeth at least twice a day for 2 minutes, use a dental floss and a mouthwash, and visit your dentist regularly every 6 months.